Well, thank you very much. It's a pleasure to be here. I'm John Bartholomew. Really, I'm Jerry. It's kind of difficult to know which one I am sometimes, but it's a nickname. And I've lived in Texas before. I was at Naval Air Station Corpus Christi, Texas for a couple of years, also Fort Sam Houston. So I can speak Texan if I have to, but I think right now I'm going to speak more mid-Ohio, and thank you very much for the invitation again. My talk is on herbal medications, and I understand I have to point. There we go. I have no disclosures financially, but I have a disclosure. There's very little information on herbal medications and Dercum's disease and lipedema, so maybe we should end right there, and that's the end of my talk. But I can talk about some other things. I have one really kind of cool thing, I think, that I think you would all appreciate. So I'm at Cleveland Clinic. We have about 60,000 employees, many hospitals all over the world, actually, now. Abu Dhabi, London, and then even Canada and Las Vegas. It's another part of the world. But we have a big library, so I called my librarian. I said, I need this topic. It's lipedema and herbal medications. I don't think I used Dercum's initially. So I get back about 200 articles, and I'm thinking, wow, this is great. How am I going to get through it? And after about looking at the first 30, it was all about lipids, cholesterol. And I thought, no, lipedema. I called her back. I said, lipedema. So she worked on it in a couple more days, and it came back, everything was lymphedema. So finally I walked over and said, read my lips, it's lipedema. And still, we didn't get very many articles, I have to say that. But herbal medicines, let's talk about them. The National Center for Complementary and Integrative Health defines dietary supplements as herbs, vitamins, minerals, and probiotics. And, oops, got to point that again. Consumers spend, sorry, I'm a little fast on that, good. Consumers spend in excess of $23 billion a year on natural products marked to maintain or enhance their health. It's estimated that almost one half of all healthcare consumers use some form of herbal product supplementation alone or in combination with conventional medications. And almost 25 or 30% of people, it says 25 here, that are taking prescription medications use a dietary supplement or herbal medication. Unfortunately, we really don't know the therapeutic value of many of these products. They're not really proven, they haven't been studied. And some products may cause drug-drug interactions, and some may be even very harmful to you. For example, if you have liver disease or certain herbal medications that may harm you. And most importantly, the majority of people that take herbal medicines or supplements never report this to their primary care provider, so they don't know they're taking them. This is the trends. It goes back from 1999 to 2012 on who is using herbal medications. If you're over 65, you're more likely to use them. If you're female, you're more likely to use them. If you're non-Hispanic white, you're more likely to use them. And if you've had more than 4 years of college or 4 or greater, you are more likely to use herbal medications. So why should we use these? There are several reasons. One, they are more affordable than conventional medicine. Two, they might be easier to obtain than prescription medications. You ever tried to call your physician and get a refill on a prescription? Sometimes it's not that easy. And then they're thought to hold beneficial and healing properties. And if you go back to ancient Greece, these are 5 herbal medications: mint, fennel, olive, parsley, and saffron, that were used as medicines thousands of years ago. And then for many patients, using herbal medication kind of gives them an effort to change their own health, in other words, to treat themselves and make sure they feel good about what they're doing. And for some of you, you might have a distrust of your physician or the medical establishment in general, and so you would use herbal medications. They are easy to give or administer. They may enhance health and help with common chronic symptoms such as memory loss, arthritis, the common cold, fatigue, and leg swelling. And they're often used for chronic conditions for which there are no good treatments and no answers for cures. Now, why use? Patients perceive nature as benevolent and healing, and herbal medications may be useful to supportive care. But the concern is that, or the mistaken perception is that a naturally derived product is safe. And as I mentioned earlier, they are not all safe, and you have to be careful. So what are the most commonly used herbal medications? There are several different lists. You can go on the internet and come up with a whole bunch of lists and a whole bunch of products. Butcher's broom, I think that's in Karen's list of supplements and medications that might help us. There's one called kefir. I can't read some of these. Lymphotonic is another one. Deep Immune, I like that one. Selenium, we all know about milk thistle. Diasamine, and then berberine, a root extract. These are some that if you go on the internet and Google lipedema, herbal medications, you might come up with some of these. And then what about Dercum's disease? Well, apple cider vinegar apparently helps. Or the lipoma, it's a natural product. And then there's one called cheap herbal supplements, Triphala, and then remove lipomas without surgery, another one, and then cure lipoma, how to do this naturally. So you can get all this information on the internet, but how valid is it, and what does this all mean? These are from Karen's list that I give to all my patients to use. Improve hypertrophic large fat cell health. One, maintain healthy gut bacteria. Another one, improve immune function. Maintain normal metabolism. Lymphagogues, we just heard a lot about lymphedema and lymphatic functioning and pumping. I'm seeing a lot of pictures. I'm right over here. I'm here to take pictures. Some of you are missing. I don't know. And then another one is to reduce leaky blood in lymphatic vessels. And then I think the next page, the arrows just show some of the things we'll talk about. And then improve mitochondrial function, reduce inflammation, reduce activity of mast cells. I hear we're going to talk about mast cells later. Break up coagulated protein in adipose tissue. Reduce pain, and then they do advise you, or Karen does advise you, to not take this if you're pregnant or nursing, for example, some of these supplements. So the National Health Interview Survey in 2012 came up with a list of the 10 most common herbal medications that one might use, or supplements. Fish oil, I think we all know about fish oil. Glucosamine for arthritis, probiotics, melatonin to help you sleep, and coenzyme Q10. And then there's echinacea, cranberry, garlic, ginseng, and Ginkgo Biloba. And I'm going to use my Ohio talk as opposed to my Texan way of speaking, so I may mispronounce some of these herbal medications, I'm sorry. The University of Minnesota and the Journal of Family Practice published this over a decade ago. Ginkgo Biloba, echinacea again, garlic, ginseng, soy, saw palmetto, St. John's wort, valerian, I hadn't heard that one before, cranberry, and black cohosh. And then another one in the American Family Physician, again, most of those, but also golden seal, green tree extract, kava kava, valerian one more time, and then curcumin. So these are all commonly used herbal medications. Well, what are they used for? And then Dr. Axe, I'm not sure, is he here today, Dr. Axe, because he's on the internet too, why more people opt for herbal medications, and he has some different ones. Feverfew, hadn't heard that one before. Aloe vera, I thought that was to rub on your hands. And then turmeric, and then milk thistle once again. So I was asked by Cheyenne, what is the scientific data for herbal medications? This is from Cochrane database. This is the classification of pharmacotherapy that we're going to talk about. The natural occurring drugs, the benzopyrones, I think I'm pronouncing that right, alpha and gamma. Alpha are coumarins, not to be confused with Coumadin, which is, as you well know, a blood thinner. But the gamma ones include the flavonoid fractions, rutins, diasamine, and then grapeseed extract. And then the saponins include butcher's broom, which we'll talk about, and then horse chestnut. And then we have other extracts, the Maritime pine tree extract and Ginkgo Biloba. And then the synthetic drugs, calcium dobesilate, I'm not going to talk about, pentoxyphylline, sort of a blood thinner, along with antiplatelet agents, and stanozolol. So this is one. This is a flavonoid fraction, gamma benzopyrones. They're found in fruits, vegetables, and teas. One of them is available in the United States by prescription. They protect microcirculation from damage induced by venous ambulatory hypertension, modify inflammation, and reduce edema. And a study looking at a meta-analysis of over 700 patients There was shortened time to healing. This was for leg ulcers, but also improved venous symptoms like swelling and pain with very few side effects, maybe a little bit of gastric upset and a headache. Now, this is grapeseed extract. It reportedly reduces symptoms of swelling, symptoms of fatigue. It may reduce swelling. It may make your heavy legs feel lighter, tingling or paresthesias, and decrease pain. And then one study reported decreased swelling after 6 weeks versus placebo. Again, side effects are nausea, vomiting, dizziness, and headache, but very uncommon. And then we have the ruticides. They may help with capillary filtration rate and microvascular permeability. They may help reduce leg volume and edema. In 2 randomized control trials compared to placebo, it wasn't clear if they benefited the patients or not. Again, gastric pain and headache as side effects. Now, butcher's broom, we're going to hear a little bit more in the next couple of slides, has some anti-inflammatory properties, may improve capillary permeability and venous flow and lymphatic flow. And these have been studied a lot in venous disease with results in improving pain, heaviness, fatigue, feeling of swelling, cramps, itching, and paresthesias when compared to placebo. And this is a study that Karen published, I think, a few years ago, and I'm not sure if you're still using butcher's broom and selenium. Yeah, thumbs up, both thumbs up. And this study looked, I think they measured the total volume reduction. And if you look, oops, went too far, but on your left, you can see the legs, and on the arm of this patient who received 1 gram a day of butcher's broom, which helps with lymphatic flow, and then the anti-inflammatory properties of selenium, along with MLD and histological variable manual technique. I don't know that I've ever seen that term, but I've seen it, but I never know what it was, so I had to write it down because I didn't know. Do you call it HiveMat or HivMat or HivMat? Thank you. Going to learn something every day. Anyways, there was a total volume reduction, and they concluded that butcher's broom and selenium may offer a new tool in conjunction with manual lymph drainage, physical therapy, to improve swelling and pain. So interesting. Now, I use a lot of this. I do a lot of venous work. Actually, I tell this every year, but I first learned about lipedema 30 years ago on my first week at the Cleveland Clinic, and my boss then said, well, this is lipedema, you can't do anything for it, and, but you'll see a lot of it. So about 2 years ago, I talked to him about what I've been doing lately, and I said, I'm kind of interested in lipedema. Well, you can't do anything for it. Of course, he's 97 now, so he may not have been keeping up with times, but I remember that vividly. Anyways, back to I see a lot of venous disease, and I do actually recommend horse chestnut to my lipedema patients to try on occasion. Side effects really are very uncommon, a little bit of nausea, headache, sometimes they itch, but it does seem to help with leg pain and reduce swelling. And then Maritime pine tree extract has some antioxidant, anti-inflammatory, vasodilator, and antithrombotic effects. And in one trial, it completely resolved edema in 60% of the patients. So this is Maritime pine tree extract. And then lastly, Ginkgo Biloba has antioxidant and vasoprotective effects. And one of the reasons that slide I showed you on trends, if you look closely, that some herbal medicines are being used less often, is that this drug, although it was thought to help with Alzheimer's disease and memory, hasn't been shown to be quite as effective. Now, some other common herbal medications to talk about: holy thistle, lady's thistle, or St. Mary's thistle, known as milk thistle. And what are some of its effects? Well, first of all, it's been used for 2,000 years, still around, and found in Kashmir, which makes it quite exciting, I think, but also the United States. It contains bioflavonoids, increasing immunity and slow down oxidative stress, and may have some anti-inflammatory and antioxidant properties. Black cohosh, black snake root, is another name for it, and I suppose they would call it rattle root in Texas for rattlesnakes. But it's used as a smooth muscle relaxant and has some anti-inflammatory and may have some effect on osteoporosis in postmenopausal women and maybe even dysmenorrhea, which we just heard a lot about previously. Ginseng, also called five fingers, Chinese or American, used for centuries in Asia and even North America, may help with weight loss, may help boost the immune system and reduce inflammation, and decrease fatigue, increase physical performance, and improve mental function. Kind of interesting. Turmeric, also known as jingwang, I guess, or Indian saffron, has a long history, over 4,000 years, and it may help in my area that I most do a lot of, prevent blood clotting, but also may help reduce inflammation, relieve arthritis pain, and have some anti-inflammatory properties. St. John's wort has been used for antidepressant activity and fighting inflammation, but you have to be careful with that medication. It has some drug-drug interactions, which we'll talk about in a moment or two. And then the American coneflower, also known as Kansas snake root or purple coneflower, which are beautiful, a Native American remedy used as an immune stimulant for immune support, but sometimes used to help prevent colds. And cranberry, I think many of you are aware of that, to help prevent urinary tract infections and or kidney stones, but has some antioxidant and cardiovascular effects. Now, this is a Journal of Evidence-Based Complementary and Alternative Medicine publication looking at phytotherapy or plants to work on and treat obesity. And interesting enough, some of the compounds or active ingredients are caffeine and ephedrine. You have to be very careful with ephedrine. It has some side effects that are pretty nasty. Capsaicin, I use this topically for my patients with neuropathy. Yohimbine, phytosteroids, chitosan, guar gum, not sure what that one is, and I can't pronounce the plant name, nor will I try. But ma hung, or ma huang, is the plant name for caffeine and ephedrine, and chili pepper for capsaicin. So these are articles, this is an article I read recently that talked about herbal medications, and then there are some herbal medications on the market that contain, like for example, Slim Quick contains celery, dill, green tea, and of course green tea contains green tea, but then there's Carvil, which also contains celery, sorrel, cumin, or anise. So these are all herbal medicines that are out there that I don't know that there's a lot of data on them, but I just threw them out for your benefit. Now, I was asked to talk about marijuana. The last time, I have to admit, I tried it once. I didn't inhale. And I did it at a very inopportune time. I was in the military at the time. If you got caught, you got 7 years in prison. And and the reason I took it was, just aside, I know it's going to take a little more time here, but I was in the Army. I got shipped to a Navy base, and I was at a Navy base in an Army uniform, and all my roommates thought I was with the DEA. They were sure I was undercover. And one night we all went out drinking, and they kind of cornered me and said, let's take, they had some weed with them, and I tried it to make sure they thought I wasn't that, and they didn't kill me or beat me up or anything like that. But so anyways, this is, I thought, very interesting, and I know Karen would know a lot more about this than I would. But it talks about how adipocytes are dysregulated and leads to imbalanced energy storage, obesity, and associated medical problems that we all know about. Now, the cannabinoid receptor type 1, CB1, is known to have a substantial impact on the regulation of energy metabolism via central and peripheral mechanisms. And so in this article, they talk about mice with this deletion of CB1 encoding gene were protected from diet-induced obesity, and also it helped to reverse the phenotype in already obese mice. So I know, Karen, you're probably well aware of this data, but I thought it was quite interesting. So what about the effect of cannabis among adults with chronic pain? Because many of you have chronic pain. Unfortunately, 100% of people who take marijuana die. It's a fact. And this little lady on the right, she looks like 70 or 80. You can see how happy she is. She might be... Well, she probably owns the company that's producing marijuana in Colorado or somewhere else. But this picture in the middle is what I remember the only time I took marijuana was a psychedelic effect. So anyways, this is a recent article in the Annals of Internal Medicine, a well-respected journal in internal medicine, looking at benefit for pain. And there's limited evidence, apparently, from from this review. but it does seem to help neuropathic pain, whether it's central or peripheral, like a peripheral neuropathy, in some patients. But it doesn't seem to help pain in MS, multiple sclerosis, cancer, fibromyalgia, rheumatoid arthritis, or inflammatory abdominal pain, as much as it does help somewhat with neuropathic pain. So back to our herbal medicine, what are the complications? Less than 5% most of the time. GI are the most common, headaches, itching, always avoid in pregnancy or if you're breastfeeding. Nausea, vomiting, diarrhea. I tell my patients this. Now, there may be some side effects. Nausea, vomiting, diarrhea, fatigue, dizziness, allergic reactions, rashes, asthma, headaches, dry mouth. But go ahead and try it because you might not have any of those. And then this is drug-drug interactions. For example, if you are on a blood thinner and you take ginkgo or garlic, you may have bleeding. If you are taking Panax ginseng, you could have mania. Not a good thing to have if you are on an antidepressant. And then if you are on steroids, don't take the herbal medicine licorice or the Chinese herbal product Shoshai toe, I guess, if you are on prednisone as well. So, and then if you take senna, a lot of people take senna and cascara, you might have decreased absorption of certain medications. So there are drug-drug interactions, and I know I'm probably running out of time. So healthcare practitioners like myself should caution patients against using some herbs and pharmaceutical drugs. Just a few more slides talking about other side effects. Motor vehicle accidents might be increased if you're on marijuana or cannabis. Your pulmonary function, probably not too much affected. If you have an MI within an hour of taking marijuana, that might be the reason they're blaming it on you, that you smoke some weed. Suicidal behaviors, mania, psychosis, and are really, the evidence for these is really quite low that this is, time's up. See that? Can you wave it more so I would see it? Thank you. And then there may be some long-term cognitive effects, but not really sure. So what should the patient do? I just have a few more slides. If you are thinking about or already using an herbal medicine, discuss this with your doctor. Ask if he knows anything about it, might not, but if he or she. Ask if it has a proven benefit. Will it interact with other medicines? What are the side effects? What is its safety record? And monitor yourself for adverse effects, but also therapeutic benefits. See if it works. And that's what I tell patients. Give it a try. If it helps, great. So why don't patients such as yourself, and I'm a patient too, why don't we talk about, I don't tell my doctor I'm on herbal medications. Why that? First of all, we don't ask as physicians. Two, we don't think, maybe we don't think the doctor needs to know. And then another option is the doctor doesn't have time to talk to you about herbal medication. You are concerned about a negative reaction from the doctor saying, oh no, you shouldn't take that. And those are just a few things, and I'm out of time. So what should you, as a physician, do, those of you in the audience? Ask your patient about it. Be non-judgmental about herbal medicines. And we are often uncertain in the quality in the few well-designed trials to know if these drugs work. So we aren't knowledgeable. If the patient decides to use herbal medicines, they should be monitored for benefits or adverse reactions. Again, if you're pregnant or breastfeeding, don't use. And then if you are going to use it, look for a brand name that's very helpful. Here's some potential source of information about dietary supplements you can get, and I think you'll probably all have this available after, because we're recording everything. And this is Steve Dean. Unfortunately, he's not here. He always shows a picture of me and tries to get to my nerves a little bit. I don't know what he does, but this is Steve Dean. He'll be talking tomorrow, great speaker. Contact him for herbal medications. You can contact me too. Thank you very much.